Hi, I'm Gene Bruno, Professor of Nutraceutical Science at Huntington University of Health Sciences. And today I want to talk to you about resveratrol and COVID-19, specifically about some really interesting research about this. Now, let me start with addressing when does a pandemic become an endemic? Okay, so data suggests that there is a decline in COVID-19 related deaths and hospitalizations. But the problem is this keeps changing, and we still don't know for sure when the pandemic will officially end. We've found that because of the pandemic, there has certainly been an increase in consumer awareness of the importance of nutrition and the importance of supplements with regard to immune health. This has certainly been reflected in data showing that the global market for immune health supplements is estimated to be over 20 billion just for 2022 alone, and is projected to reach over 27 billion by 2026, only a few years away. Now, with all of these supplements being purchased for immune health, you have to ask which ones actually work. Well, certainly your fundamental nutrients, your vitamin D, zinc, vitamin C, and so forth, do have an important role to play in immune health. But there are some lesser known nutraceuticals which have a tremendous impact. Resveratrol is one of those. So let's talk for a moment about still beans and coronavirus. Still beans are compounds that are found in plants, the most well-known of which is resveratrol. Now, there was an in vitro study. In vitro is just like a petri dish that has cell lines, and you expose those cell lines to different things. That's an in vitro study. An in vitro study found that still bean compounds inhibited coronavirus replication. Now, another in vitro study found that resveratrol specifically inhibited coronavirus infection, and it prolonged cellular survival after that infection occurred. It also decreased replication of something called a nucleocapsid, which is a protein that's needed for the coronavirus to replicate. And if that weren't enough, it also down-regulated apoptosis, which is cellular death, which is induced by coronavirus. So this is very interesting. These in vitro studies are suggesting that, hey, resveratrol may have an important role to play with regard to mitigating coronavirus. But what we really want to see is not just in vitro studies. We want to see studies in human beings. So enter gamma delta T cells. Well, gamma delta T cells, they are something that function as a first line of defense and a bridge between innate and adaptive immune responses. So innate is kind of like your general immune responses, and adaptive immune responses are like an antibody is an adaptive immune response. It's very specific for specific pathogens. Okay, now, what we found in research that was published in the Journal of Infectious Disease is that the gamma delta T cells increased significantly about 3 months after healthcare workers were exposed to coronavirus and got a coronavirus infection. Now, this was back in 2003, so it was prior to COVID, but it was a different kind of coronavirus infection. Nevertheless, it demonstrated the importance of gamma delta T cells in helping to fight against coronavirus. Now, what's really even more interesting is that a human clinical study that was published in the journal Accredited Medicine and Cellular Longevity found that 1,000 milligrams a day of resveratrol significantly increased circulating gamma delta T cells. So these same immune cells that help to fight against coronavirus, you can help to increase them potentially through supplementation with 1,000 milligrams a day of resveratrol. But you still have to ask the question, well, that's interesting, but does it actually really have any effect on COVID-19? So let's talk about a study that is very recent. How recent? 2 weeks ago it was published in the journal Scientific Reports. And it was done on 105 COVID-19 outpatients, meaning they had COVID-19, but they weren't hospitalized. Now, these patients agreed to be part of the study, and they were given either a placebo or resveratrol, and the amount of resveratrol they took was 1,000 milligrams 4 times a day. So that's 4,000 milligrams a day. That's a lot, and they did that for 15 days. Everyone, including the placebo group and the resveratrol group, also received a single 100,000 unit dose of vitamin D, which of course is very important for immune health. The results of the study show that when you compare it to placebo, the resveratrol patients had a lower incidence of hospitalization, 3 times less. They had a lower incidence of emergency room visits, 1.7 times less. And they had a lower incidence of pneumonia, 2 times less. This is really very significant, and to my mind, clearly demonstrates that resveratrol does in fact have a very positive role to play in mitigating some of the effects of the COVID-19. Another interesting study that was done that I'm just going to wrap this up with is a study done on resveratrol and ACE2. So angiotensin converting enzyme 2, or ACE2 for short, is actually a receptor found on the surface of cells, and that receptor enables the entry of the SARS-CoV virus, which is the COVID-19 virus. It allows the entry of it into the cell. It's kind of like a doorknob that opens it up and says, come on in. Well, ACE2 is prevalent in adipose tissue, fat tissue, and as a result, it becomes that fat tissue, that adipose tissue, becomes a potential SARS-CoV reservoir, contributing to that viral spread in COVID-19 patients with obesity. And I'm sure you've heard that patients that are overweight and are obese have a much greater likelihood of getting COVID and getting really sick from it. So in this study, 11 obese men received 150 milligrams a day of resveratrol, a lot less than the last study, but still a good dose. Or they were given a placebo, and this was done for 30 days. Now, these are not men who had COVID. These were men that were healthy and did not have COVID. The results were, when you compare it to placebo, that the patients taking the resveratrol had markedly decreased ACE2 levels, about 40% less. So that's significant, because remember, it was those ACE2 that helps to enable the entry of the virus into the cells. So the researchers concluded that this reduction in ACE2 might help to dampen the SARS-CoV spread in COVID-19. So pretty cool stuff. And I think collectively it makes a very good case for the value of resveratrol supplementation when it comes to helping your immune system, potentially helping to mitigate some of the effects of the COVID-19 virus. All righty. Now, thank you for listening. And if this was interesting to you and you say, man, I'd like to learn more about nutrition, I'd like to learn more about nutraceuticals, I invite you to visit the Huntington University of Health Sciences website, or send us an email, or give us a phone call and learn about our different academic programs, our short courses, our undergraduate diplomas, our different undergraduate degrees, and our graduate degrees in nutrition and integrative healthcare, which includes a lot of data on nutraceutical science. Thank you.